All right, welcome back to the Lightning Step Couch here at Global Exchange Conference 2023. My name is Benjamin Turner. I am your behavioral health advocate. Sitting next to me is Joe Roller, the owner of Lucent Recovery out of Austin, Texas. Organization's been around for about 2.5 years. Joe, thanks for joining us on the
Absolutely.
couch, man. Nice to
Absolutely.
meet you. Tell us a little bit about Lucent Recovery and what services you offer.
Absolutely. So Lucent was founded about 2.5 years ago. Chris Hudson is also one of the owners. He started it doing some coaching and some therapy in Austin, and his whole vibe was like doing it outside the box.
Mm-hmm.
He doesn't do coaching where like you go meet for coffee and how's your week going.
Yeah.
They really get guys active and engaged in life. Do a lot of like outdoorsy stuff, man, hiking, mountain biking, kayaking, take dudes fishing, stuff like that. Like they do all kinds of stuff.
Okay.
And then the therapy kind of mimic that, just really experiential,
Yeah.
outside the box, and just breaking away from like just sitting on the couch and talking.
Yeah.
And then so me and my friend Zach, we've been working together for a long time, and we were going to do something similar with some programming. Like we want to go outside the box, and so it just looked like it's all joining forces. So
Awesome.
so we're adding an IOP to it. It's primary mental health, and
Okay.
it's really focused on experiential and
Yeah.
psychodrama, and just kind of breaking the mold of what IOP and like outpatient programming and treatment has really looked like.
It's awesome, man.
It's pretty dope.
Yeah. How do you see people in treatment responding differently to that outdoor type therapy
No.
as opposed to in office?
Yeah.
How do you see them respond to that?
Well, I mean, from what we've seen, they flourish,
Yeah.
right? But I think people do well in all settings,
Yeah.
But it's just the idea of having a different option.
Yeah.
I think, because I've been a therapist for going on 7 years now,
Mm-hmm.
and there's a lot of power to be done one on one, sit in the office, and then also there's a lot of power that can be had when you're just outside and comfortable and like really, engaging in life.
Absolutely.
Yeah.
Do you feel that those types of programs are accessible to everybody across the board, even those folks that don't find themselves as outdoorsy people? Do you
Yeah.
see them have, respond to it positively
Yeah.
once they get out there?
For sure. And if there's ones that's like it's completely not their vibe, there's adjustments we make.
Yeah.
If their thing is more of like I'd rather just sit down and have a conversation, we'll work with them on it.
Yeah. Yeah.
But it's definitely it's engineered to where we get people really active in life.
Yeah,
You know.
absolutely, man.
Mhm.
I personally am not in recovery, but we see it across the board throughout organizations that people fall into this industry because they're in recovery themselves. If I understand correctly, you're not in recovery.
No,
So how
no.
did you get into this? Where'd your passion stem from?
Man, I got into this begrudgingly.
Okay.
Honestly,
Okay.
honestly.
Yeah.
It was funny, man. Going through school, undergrad, grad school, I had professors, they always ask, what would you like to work with? What would you wear?
Yeah.
And my thing was always want to work with kids, and I didn't want to work with addiction, like teenagers. And they would always laugh, like, be careful with that. The one thing you say you don't want to work with, you're going to work with. And I fought that, man, for like a year and a half. I graduated, got my license, and the only doors that would open was substance abuse related.
Okay.
And then finally, about a year and a half in, I was like, I'm just going to quit fighting. And I was where I was supposed to be.
Yeah.
And it was pretty evident within like 4 to 6 months, like this is where I need to be. And so I quit fighting it, and it's gone well.
Awesome, man. I
Yeah.
feel the same way. As soon as I stepped into the industry, I knew where I needed to be, and it
Yeah.
was right here. So I love that story. I'm going to talk a little bit about tracking long-term outcomes after care. Okay. So, what long-term outcome metrics are most meaningful to monitor after discharge? For example, symptoms, quality of life, functional
Right.
status. What's most meaningful?
Well, and I think arguably all of them are
Hmm.
meaningful, right? But it's also got to be about the convenience of it, right? The relevance of it, specific to each client. But I think generally speaking, man, like looking at like how their trauma's going, and that's an easy thing to assess. With it's called PCL. There's a
Hmm.
few versions of it. Same thing with like depression, and anxiety. You got the GAD, you got the PHQ, and just checking in with them, after that, and just see how those things are going, see how those symptoms are maintaining, but then also like a little face to face, because most of the stuff in our industry is like self-report,
Hmm.
so it's like checking in with them, how their life's going, what's going on, like are you struggling with this, are you struggling with that, and then adding in the questionnaire, it just helps see how they're maintaining their progress, right?
Makes absolute
Well, yeah,
sense.
because you got to think about it, like in treatment, even with outpatient, there's various levels of bubbles,
Hmm.
right? And it's easy to do. It's easier to do really well in a bubble versus when you're out there actually living with life on life's terms.
No doubt.
You know,
Yeah.
and when we can check in on that and make sure that progress is being maintained, then whatever program or whatever therapy, whatever they did, we know it was really effective and it's ongoing.
Absolutely.
Yeah.
That it's important to track that stuff. What can technology like apps or patient portals and even wearables,
Yeah.
how can they enable ongoing outcomes and tracking?
I think tremendously. You know, when I got into tracking outcomes and everything like that, I did it very manually.
Mm-hmm.
But there's programs that like they can log in and do stuff. It sends it on their phone. It
Yeah.
makes it pretty easy. And even recently, I've been talking to people that are using these rings that like
Yeah.
track, you know, like their
Mhm.
heart rates and stuff like that. And it's that's really intriguing to me as a trauma therapist, right? Because like sometimes people spend their whole life like hiding their symptoms and their signs. And when you have that giving you real time
Yeah.
information, it's like you're saying you're cool,
But
but
we
this,
can sell.
this
Yeah.
is saying your heart
Yeah.
rate's through the roof, man.
Yeah.
Like
Yeah.
let's dig into that. Maybe there's
Yeah.
something more there, right?
Yeah.
Or it's even enough to say, hey, like maybe it's time for like let's just kind of calm the conversation for a minute. We can come back to that.
That's awesome,
Yeah.
man. Yeah. I think it's super helpful to have those items. Um, how long after discharge is it feasible and useful to continue collecting information? How long can you keep doing that, or how long
Yeah.
do you think that's appropriate?
Well, I mean, the appropriate answer is, you know, going in line with the state regulations and things like
Yeah.
that, because they have certain deadlines and stuff. But I think probably in the initial beginning, you know, monthly.
Yeah.
I'd say at least monthly for probably 5 or 6 months, and then
Mhm.
after that, you can probably break it down to quarterly for a little while, and then, you know, once they're like solid, once or twice a year.
Yeah.
Yeah.
Absolutely. Um, any ethical considerations that exist around contacting patients long term or at long after their treatment ends? Anything that you feel is an ethical thing to not do, or we should be doing?
Yeah, I think actually I say yes, but not necessarily ethically with the clients, right? Because they were a client, we can follow up with them, this, that, and the other.
Hmm.
But also I think sometimes like it's good to get information from family members and people that were involved with their treatment. Whereas that's where we can get into the ethical issues, because you know if the client gave us consent for that family member
Yep.
or you know other professional, like that only lasts for a year.
Yep.
And so if you're not paying attention to that, and you know, when you checked in with the client, say they're a year and a half out, and it's like, okay, everything sounds good. I just want to make sure I'm gonna check with mom or dad, and you go ahead and call them, but that ROI is no longer in place.
Yeah.
So you got to make sure you're staying up on those if you're touching base with the whole system.
Yeah, it's good to know. You need to make sure you're aligned with those
For
regulations
sure.
so that you can keep doing what you're doing and hopefully
Yeah.
advance how well you do it. Joe, it was really a pleasure for you to sit down on the
Absolutely.
couch with us. I
Yes.
really enjoyed it. Again, this
Yeah.
is Joe Roller over at Lucent Recovery in Austin, Texas. Check him out. He is the owner, and we really appreciate him sitting down on the couch today.
Yeah.
Thanks so much, man.
Awesome. I just want to clarify. I'm one of 3 owners.
One of
There's-
3 owners.
There's 3 of us.
Okay, yeah.
We got to
Gotta
share
make sure that's clear.
we got to share the love, man.
All right,
Yeah.
man. Thanks so
Awesome.
much.
Thank you.
Yeah.
Yeah.